And there are other cases, any significant case of hepatitis B would be one that would be managed at the state level, is also what I was told by the state directly. And then depending on if there was a cluster, then the local board of health through me would then be looped into that and either involved in case investigation or looped in to be made aware of what was going on.
Mm-hmm.
So one case of hepatitis C, and again, in that number, that was a confirmed case, not one that I was involved in any investigation, but again, not concerning in that number. Influenza was 21, and those were, that's a number that is not concerning at this type of time of year. We see flu into May typically. Lyme disease, 2 probable and 1 suspect for a total of 3 cases. And again, not a, I think that the uptick in tick-borne illnesses overall, something to note and pay attention to, but this particular number, not particularly concerning. The coronavirus number, again, at 14, not an atypical number. 1 case of strep pneumoniae, bacterial infection, again, caused by respiratory secretions, coughing, sneezing. This was a whole blood sample with an ultimate pneumonia diagnosis, and my part of case investigation was just confirming what vaccine history was present for this case, but again, not a particularly concerning number. And then 4 cases of tuberculosis, all TB infection, not TB disease. And so I talked to the state epidemiologist also about this number, because I knew that this number would appear more as a red flag, but really it is not, in that it's all TB infection. So these are not cases that are capable of spreading illness at this point in time. They're all connected with care and would be referred on for either more testing or treatment to prevent the occurrence of tuberculosis disease, at which point the tuberculosis would be potentially spread to others. So again, it appears more like a high number, but I think with the number of new arrivals too that we see in Massachusetts, part of that can be explained that way. So that's it for communicable disease. Any questions on that piece? And then I'll just say a few things about what was done in public health nursing otherwise this month. So we did have another immunization clinic at the Concord shelter for routine childhood vaccine catch-up just last week on the 17th. And there were 7 children from the Concord shelter that were vaccinated ahead of camp entry, and 2 more from other local towns. This was a regional effort. The local health intern who will be aiding us with the community health needs assessment is set to start on the 3rd of June. So that is exciting, and he accepted that role. We do have a public health nurse section of the Concord Health Division's webpage. which has a lot of links to health resources and information. So that's now live. And we talked about this at the last meeting, but it was something that was done in the month of March, that emergency preparedness talk at the COA. So just mentioning that once more. That was it.
Great, thank you. Chair and board member reports. So do any board members have anything they want to report?
We have this needs assessment work going on, but we'll be talking a lot about that later today. It's interesting, it's fun. There's great epidemiologists that have been doing amazing work gathering data, which is just pretty comprehensive and exciting to see. So nothing else besides that. Actually, I can update you on food insecurity in the area just from an open table number that prior to the pandemic, they were probably servicing about 100 to 150 family households a week for food. And now they're seeing 200 to 400 households a week. So just to give you a sense, the food insecurity is really a significant issue right now. They're giving away 1,500 prepared meals a week. The demand is just really escalating. So just something to keep in the back of your minds.
Groceries since pre-COVID are, I wouldn't say double, but they feel like it. They're much more significant increase just in my own home.
Right. Right. And also the Greater Boston Food Bank is actually having a harder time fulfilling the demands from all of the local pantries around for various reasons, including their own staffing issues and supply issues. So another just, important thing to think about as, you see local food drives going on and just think about there's like significant hunger in the communities and challenges in addressing it.
I'll just mention two quick things. We submitted our recommendations for new board members, so we're waiting on the town manager to act on that. And then second, I mentioned this to Melanie and Randy, but on our well regulations, I did get an inquiry from a citizen who also happens to be a neighbor, so she wasn't shy about reaching out, asking about, whether or not our well regulations dealt with drought conditions, and I explained that it was something we decided would, should be a town meeting item if it were to be taken up. And so I just mentioned that so that the board, remembers to consider whether or not they want to do that for next year's town meeting. And that's all I've got. Melanie.
Great, thank you. I just wanted to start by saying a super thank you to both Mark and Jill. Today marks my 2 years, right, in the town. And in both those years, I either had Jill or Mark to lean on as the chair to keep me appraised of town as a new person, right? To know what was going on in the town and who was who and what was up. So both of them have been a huge resource to me. And I want to say thank you. Thank you for your service to the town. Thank you for putting public health forward, right, as an important thing to spend your free time with your families and your rest of your life on. That's really meaningful to me. And the team here and the town may not all know it, but they should all really thank you for all your hard work through the pandemic. For both of you have like over 6 years of service on this board. So that means you weathered through the pandemic, right?
Yeah, it was fun.
And all the feedback, good and bad and otherwise, from the community. And with your departure, that means this department has had 100% turnover in staff, and the board will be 100% turnover.
Yes.
So you two were the last holdouts. So we're all new as staff, and the board's all new as
But you're not
board.
new anymore. Now
No,
you're a
I'm the
veteran.
old one, I guess. 2 years. When I took the job, Alan Cathcart told me, don't quit till you worked here 2 years. Give Concord 2 years to be here. Like, give it a solid 2 years to figure it out. And I promised him I would. And now when he sees me, it hasn't been real condition, stay for 3. That's what he tells me. So it's not been real. You haven't had the real experience. Stay another year. I'm like, okay.
Mm.
I do have some actual technical updates. This afternoon, Jill and Maura are going to be presenting at our Concord Behavioral Health Collaborative at 1 at the library. That is our initiative to address opioids prevention, mental health, and we're big push for our public health needs assessment. Maura mentioned she has a intern coming to help with that. Jill's put a lot of time and effort into the data in the last year, plus to understand what we have and what we need. And that will help inform this board and ourselves what we're going to need to do moving forward for funding requests, for programming, both with the opioid monies and all our other needs in the community. So that's kind of exciting. So going to be a bit of work, but that's coming down the pike for this summer. We signed a contract for an animal inspector with Boardman Animal Control between now and July 1st, and we will be putting out an RFP hopefully soon for a public bid, if you will, on how to have an animal inspector. That's for rabies control, response to quarantine, if there ever is one, for animals and complaints. Ebony's been working hard on the beach contracts, those going out. The beach testing starts a week for all the semi-public beaches the week before Memorial Day. The water tested, and we inspect and permit those beaches. If anybody asks you, the week prior. All of the permits for food, hazardous materials, animals, camps, and pools are now, like, all are expired end of May, but they're all due for renewal. So we're working with all the team here to make sure everybody's getting their camp and pool inspections. The food stuff is updated, and the animal inspections are out there. I taught last week at the Council of Aging a cooking class. I am in the weekly update. There's some funny pictures if you want to get a chuckle. My background, my first career was in food chemistry, so I've shared some of my fading expertise on food science, and had a great time with some of our seniors at the Council on Aging teaching folks to cook. I really enjoyed it. I was surprised how much I enjoyed that group, but it was wonderful. We're continue to work on training. I got my certified health officer last month, I guess. Mike is now technically a system inspector. He was before, but now he's got the certification. Couple of things moving ahead. White Pond. This year, we're going to propose to the select board that we change the course of how we test. So the last 2 years, we have done weekly or bi-weekly water sampling, where we've gone out, taken a sample, a whole lake water and a concentrated drag sample, and looked at it under fluorometry for presence of cyanobacteria. And this year, given the last 2 years, we haven't closed. We've had no presence. The labor and time and effort to do that is kind of a lot for this department and our current staffing level. So what we're intend to do is still monitor, still have the reporter bloom, still have that capability, and we have all the equipment, we have all the technical know-how, but also we purchased some test strips. So if there is a question, we can take a water sample, freeze it, lyse the cells, and then test for presence of toxins. So we can have more same day. The state is also going to have a training this month on they have a new beach portal. So that's also evolving at the state level. So cyanobacteria isn't just a Concord problem, right? It's every little pond in the state is having a similar problem. Hence why there's a lot of interest with John Higgins' APOD technology and what was apparently able to work, but also like how and what they want us to, but they haven't released too much. They just said, coming soon, our new portal. And this is what, if we close the pond, it's a minimum 2 weeks. So I do want to have the ability to be confident that there is a toxin present for good, for closure and for also for safety, right? To make sure we feel comfortable with what decisions we're making.
So we're doing the APOD again. Yeah.
We're going to do a modified CPOD. So the concept is we're going to go to a more long-term, I would say before we've been using like compostable APOD, and now the CPOD is more put it in every year in the last 10 years. Put it in, take it out, for the cost. It is still substantial cost. I believe it's somewhere around $40,000, but it could be not coming out of the NRC budget at this juncture.
Is that from the same group?
Same person, the Higgins Technology, where we have a meeting on Delia and I with John Higgins this week to figure out the details, and I'll put a memo together that I will share with this board. That I say, this is what I'm proposing to the town manager. It won't work for me to give it to you before the next board meeting to have approval, but I'll send it to you. There's always feedback and opportunity for feedback, but that's the current plan. There is some concern around White Pond about PFAS that have come through and having some testing, and I don't have an answer to that, how that's gonna happen or who's doing that, about people swimming and fishing and around there. And then we do have an offer out to an inspector. So that's exciting. I feel that the person is in the review stages. So in Concord, you do a background and a physical. So pending all of that goes according to plan, then we should have somebody looking to start.
That's exciting.
Any questions on anything that's going on? Okay, that's all I had. Mike, did you have anything else I forgot? Everybody, did you have anything else I forgot? Maura, did I forget anything? All right, I think that's the top level.
All right, we will now open the meeting for public comment. I see there's a Wade who joined the meeting, although I think he might be a relative, but he's a member of the public if he has any comment, or if anyone else in the public has comment. I would ask that comments be limited to 3 minutes. All right, hearing none, we'll close the session for public comment. And then I guess just as a final matter, I would move to approve a resolution that thanks Jill Block for her exceptional service to the Board of Health. I think I've served with a lot of really good Board of Health members, but I think Jill probably was the most, rolled up her sleeves and was hands-on in the role, including when we had no public health director for a time period, and even now, like, we're talking about
she's
this afternoon,
helps me out a lot, right?
So somehow, you've gotten this amazing free volunteer for a long time. And I would just say that, in the spirit of citizenship, you can still be a volunteer without being on the Board of Health. So you just, can keep that in mind and be involved.
Don't worry, I've articulated that.
Yeah, but anyway, she's done a phenomenal job, and I think it's worth noting. So I move to thank Jill Block for her exceptional service on the Board of Health and to the town of Concord.
No, thank you so much.
Do I have a second?
Second, yeah.
All in
Yeah.
favor?
Aye.
All right, great.
That's very kind. Thank you. It's been a labor of love.
And with that, I will entertain a motion to adjourn the meeting.
To adjourn.
Second.
All in favor?
Okay.
Randy?
Yeah.
I mean, Kurt, sorry. I was looking at the-
Approved.